Rita Bhardwaj has been a community health worker in New Delhi since 2008. She is among the million women in communities throughout India who form the backbone of its public healthcare system. During the COVID-19 pandemic, they were at the front lines. They risked their lives and faced social stigma to perform their duties without even basic safety kits.
During the COVID pandemic, we couldn't get masks. We spent our own money to buy gloves and masks. We also used to leave our homes and children to be at someone else's stores, and we would get asked, "Do you have corona? We will also contract it."
Bhardwaj recalls the grueling work hours through the first two waves of the pandemic.
It used to take up all our time. We conducted surveys, took care of people, gave them medicines, monitored their blood pressure. We used to provide all healthcare services for long hours. Try and imagine, when did we have time to eat, drink, go back home?
Under the National Rural Health Mission, every village in India selects a female resident as an accredited social health activist or ASHA. The Health Ministry trains workers like Bhardwaj to connect their communities with the public health system. They deliver initial health care, especially to deprived women and children. These on-the-ground healthcare workers were recently recognized as global health leaders by the Director General of the World Health Organization. But international honors have little or no bearing on the daily lives of women who make at most $39 a month.
ASHA means hope. These women health workers have been a ray of hope for all those struggling through the pandemic and its lockdowns. Unfortunately, their pay does not reflect their worth. They have been on the streets demanding fixed salaries and better wages for the hard work that they do, which has now been globally recognized.
Shweta Raj, an advocate for ASHA workers' rights, has been at the forefront of such protests.
During COVID, they were only given 1,000 rupees as an incentive. That too wasn't paid regularly. It's a joke considering the hard work by ASHAs. 1,000 rupees means 33 rupees a day. You can't even buy a sanitizer for 33 rupees. If you really want to honor the ASHAs, give them the status of government workers, pay them fixed salaries, and provide them a social safety net.
According to the ASHA Workers Union, at least 150 of these healthcare providers have lost their lives to COVID-19 and related illnesses during the pandemic, but the majority are yet to be compensated. These workers make sure people living in poverty can get primary healthcare. They have been praised at home and abroad for the work they do, but the honor they most want is to be paid what they are worth. Smita Sharma, TRT World, New Delhi.